Hello, I'm sure you clicked on this video because you want to know what kind of disorder this is. But if you find that I'm like out of breath and just very low on energy, it's because I've got very low iron at the moment, and we are trying for me to get an iron infusion. And as my GP said, my iron is kaput. There's literally nothing in my body, and so I just can't function. But I really wanted to make this video because it's been coming on for a long time. A lot of you have been with me since all my health issues arised, and I'm sure a lot of you want to know what this condition is because it was also the first time I heard about it. And I'm not going to go into the whole story about it, but I think I just want to explain what it is, what my symptoms are, what's happening, etc. So I have trigeminal neuralgia, and well, trigeminal neuralgia slash migraine slash atypical nerve pain, and it is a chronic pain disorder, well, trigeminal neuralgia specifically. And my diagnosis was quite early on, so a lot of you are aware that I suffer from headaches or migraines specifically. I have a long history of it. I remember me being in high school and having headaches and throughout my marriage, and last year it just was really bad, to the point where I told myself I have a brain aneurysm, I have a brain tumor, because if you've ever experienced a migraine, you know how excruciating it is, how debilitating it is just for, you know, yourself. Now imagine that times 10. That was what I was experiencing. I would have headaches 5-6 times a day. I don't know how I made it through 2022, to be honest. I kept going to my GP and they were like, listen, we think you need to go and see a neurologist. Now at the time I wasn't on medical aid, everything was out of pocket. I only went on medical aid in September of last year, and I ended up going to my neurologist, and I never thought that specialists like that are so rare. And so getting an appointment was really difficult. And by the time I got to her, I experienced something different. I still had headaches, but I started having facial pains, specifically my jaw, my cheek, my eyebrows, my temples over here, and it was such an odd experience. But obviously she went off what my GP was referencing, that, you know, I've got this long history of headaches, and so she treated me for that. So she gave me medication, and I was like, no. I kept demanding that it's, yes, I've got headaches, yes, I suffer from migraines, but something's happening. I'm experiencing these facial pains, I don't know what it is, please help me, please listen to me. And she did actually listen to me, and she's like, she was happy that I kept demanding that she looks at what is happening with my face. So she put me on another different type of medication, and then said I have to go for an MRI. Luckily the medical aid just kicked in and they paid for my MRI, because if you know, an MRI is very expensive. So I had the MRI in January of this year and nothing came up. I was like, great, but also what now? And so she was like, listen here, I actually don't know what's wrong with you. She was blatantly honest about it, and I think I respected her more for that, because a lot of specialists will try and find something, right? But she was saying she actually doesn't know. So we tried different things here and there, and I remember January was like a great month for me in terms of medication. And then this medication wore off, and so I was getting the facial pains back. And anyway, come April, she said, almost Stephanie, you are like my one patient that I genuinely don't know the answer to what's happening, and she is going to take it to a meeting that they have where all the specialists come together and they talk about all their patient things that they're going through, like all the patients that I have, and they don't know what the answer is to. So that it's almost like a panel discussion, and she said she will put my case forward to kind of see if maybe the other specialists in that group will know. So I get an email and she says, I think you have Marthinus-Neuralgia. I never heard of it before. She said I need to go to an ENT, which is a ear, nose and throat specialist, to kind of have an injection done in my nose to numb the nerves that's here. So I did research and I wanted to, number one, understand what Marthinus-Neuralgia is. As I was going on, I was like, trigeminal neuralgia kept popping up, right? Because it's similar. I was digging, researching, and I found a video of a woman who has trigeminal neuralgia. I think she lives in the USA. And she was explaining her pain, her symptoms, everything to the T that I was experiencing. And so I sent it to my neurologist and I said, hey, I think I have trigeminal neuralgia. And this video of this woman explaining everything to the T is what I'm experiencing, because there was no many words anymore that I could explain what was going on to my neurologist anymore. Like, the words have left my vocabulary at this point. And she's like, okay, if you believe you have that, we're gonna put you on a specific medication that is used for trigeminal neuralgia. It's not gonna like get rid of the pain entirely, but it's just going to help with the pain. I've been on that pain medication or specific medication on top of the other medications that I'm on, and it has been the most life-changing thing ever. I'm so happy that I pressed her to kind of figure out what was going on, that I pressed her to be like, hey, let's pause on, you know, the migraines and the headaches, and let's deal with facial pain issue. And I still get it from time to time. Like, I will still feel weird sensations in my face, but what I was experiencing then versus now, best thing under the sun. Unfortunately, this is a condition that I'm gonna have for a lifetime. It's not something that will go away. I can only minimize the pain. Fortunately for me, mine started very early and my diagnosis was very early on, so mine is quite mild. And there are two types. There's type 1 that is like very severe, where it's like stabbing pains, and then you have type 2 that's a little bit more mild, and I fall under type 2. A lot of specialists misdiagnose people with trigeminal neuralgia because it's associated with migraines, and or like TMG, which is like you're just, you know, dealing with a jaw issue. They will make you do all sorts of things. I remember them checking my teeth and then found a cavity, and they said, oh, it's got to do with my cavity, so I had to fix the cavity. That obviously didn't work. We tried various things as well. November of last year, it was basically 6 months that she was like, I think you have this. Mostly you get this condition for women specifically, and for those over 50 years old. I'm 31 and it's not great. I'm not gonna sugarcoat it and say, oh my word, and I got this medication and it's rosy and sunshine. It's a very debilitating situation, because imagine having facial pains and migraines and various type of nerve pains that come along. I can be sitting, I can be reading, I can just be walking down the road and I will get some sort of attack. I think there was a vlog where I was literally sitting in the car on the way to the waterfront, and I'll be talking and I'm telling my husband I'm having an attack, a nerve attack, like on the side over here. You won't see it, but I can feel it, like it's the nerves are being attacked. Mostly you get like, what I got specifically, my symptoms was facial spasms or like little mild attacks. I would get severe pains where, like I said, my cheeks, my eyebrows, my temples and my jaw. And even when I go to the dentist, I tell them, hey, I have trigeminal neuralgia, and it takes a long time to deal with my teeth specifically, because when my jaw is open, it is so painful. So they have to do it in like little stages, or my dentist kind of understands and deals with it. Basically, what trigeminal neuralgia is that we all have this thing called a trigeminal nerve, and essentially it carries the sensation from your face to your brain. What happens with trigeminal neuralgia is that the nerve is being disrupted, and it causes that nerve specifically to malfunction. So mine just malfunctions. It just doesn't work properly. Often it can be that there's a tumor that's pressing on that nerve. We ruled it out that I don't have a brain aneurysm or a brain tumor, so mine is just being disrupted. Unfortunately, because this pain is so debilitating, it can take years for someone to really fully diagnose someone with trigeminal neuralgia. There isn't a formula to it. It's often coincided as the suicide disease, because imagine having to sit with pain all day every day in your face, in your head. Like as I'm talking to you now, like here are weird sensations happening over here, but that's got to do with my atypical nerve pain. It's just odd, you know. There's times where you just don't want to socialize. People won't understand what this is. It is kind of a rare condition because, like I said, it is misdiagnosed. I do find that since this journey, I don't like to socialize with other people. I can only deal with my husband, and then if I do see someone or is in a group, my social battery is really this small. I can't focus for a very long time. And it's sad because you miss out on a lot of things. Like I missed out on so many people's, you know, engagements and things because it's a lot for me. But I am glad that we got to a point where I know what this is. I can like put a name to it. It just is what it is, you know. It's something that I'm gonna deal with. There is a lot of research and studies showing that the medication will wear off, and there are other treatments, you know, like surgery, them opening up my skull and dealing with that nerve. But so many people have said that it goes away for a few months and it comes back. I think I will go over that hurdle once my medication does wear off, and if it does, we will try maybe a different solution. Like literally, this is all my medication that I take, and it is expensive. It's very expensive, the medication. If I look back from then to now, I'm a lot better. Like it's something that I can cope with, and there are days where I just can't get out of bed, and I'm trying to take it day by day. But I'm happy that we found an answer. We have something. I have one of the best neurologists ever. Like I just want to say thank you to everyone who has been on this journey with me. So many of you have really just cheered me on, told me to hang in there, gave me your support, would message me telling me maybe it's this, maybe it's that. I had a person email me, which was so rare. I hope that maybe this helps someone, that maybe you have kind of the same kind of symptoms and trigeminal neuralgia is not something that you have ever thought about. I mean, God, I didn't even know how to say it. It took me a long time to just say trigeminal. I'm glad that we're here, and I'm glad that I can say that I have this condition, and I'm just gonna take it day by day. But thank you so much for watching, and I really hope that this video will help someone in the process. I am not a doctor. I'm still learning. I'm still researching about this chronic pain condition. I really hope that I don't get to a point where it ends up just in suicide, because there were 1 or 2 times where I did openly mention it in videos that I do, you know, kind of want to end it all, because it starts getting a lot. And especially now that I've got like a very low iron, the medical aid is pushing me around because I don't want to pay for my iron infusion, or they're making me do all this blood work. I actually went for blood work this morning. You know, it just takes a lot out of you. That's what I'm saying, you know, I'm kind of just taking it day by day. Yeah, that's what I have, and I'm just gonna move forward in life.